I'm Melissa Ponzio, and this is WebMD's Ask the Pharmacist. With McCary Weck-Marciniak, National Spokesperson for the American Pharmacist Association, Clinical Associate Professor at the UNC Eshelman School of Pharmacy, and practicing pharmacist. She's here to answer the most frequently asked pharmaceutical questions put to us by you, the WebMD community. Today, we're talking about medications for headache pain, something so many Americans suffer with. Areas we'll cover include over-the-counter meds, migraines, and even drug interactions. So let's get started with this first question about over-the-counter headache relief. Can you mix ibuprofen and acetaminophen?
I would say in general it's better to stick with one or the other and probably not use both. Though they are both pain relievers and both available over the counter, they do work slightly differently. But I would think in general it's probably best for minor headaches and aches and pains to choose one or the other rather than taking both.
Okay. I take ibuprofen at night to avoid a hangover, up to 20 pills a week. What are the side effects of that?
Well, there's a couple of concerns I have here. First would be that ibuprofen will not help to prevent a hangover. There's really nothing we can do to help prevent a hangover. So I don't think in that way it's a good choice for this person at all. And they mentioned that they're using ibuprofen 20 pills in a week. So I'm not sure if this is over-the-counter ibuprofen use or even prescription ibuprofen use. But probably in either case, it's probably not a good choice to use so many in 1 week. So I'm kind of concerned about the amount this person might be taking. Now, when combined with alcohol, the ibuprofen together may cause a little bit of stomach upset and irritation. So it's probably not a good choice to combine those two together for what sounds to be somewhat routine as well. So I think I have a lot of concerns here, and I would encourage this person not to use ibuprofen to prevent a hangover. But if they did have one and needed to treat it, a couple of tablets of over-the-counter ibuprofen would be acceptable.
Okay. Is it safe for me to take 600 milligrams of ibuprofen on a nightly basis when I retire? They do help me relax and eventually fall asleep.
So I think I'd want to investigate the situation a little bit more and find out how old this individual is and do they have any other medical conditions or any other medications that they're taking. Ibuprofen itself works very well for fever and for pain. I'd think that that may not be the best option to treat their symptoms. And over time, sometimes people have rebound headaches that can come from this use. So I think I would want to investigate further to see if there's any other choices that might be more appropriate. If it's to treat muscle pain, heat might be a good option before going to bed, and a lot of people find relief from that. So I would say occasionally 600 milligrams is not a problem, but this question to me triggers maybe some questions that need to be asked in addition.
I take amitriptyline, and now the doctor has given me Ambien for sleep. Can I take the two together?
So Ambien is a medication that's often used to help people get to sleep, and we usually try to use it just in the short term. Amitriptyline is also a medication that can be used for sleep, but for a number of other things as well. And it's okay to take both of these medications together. The biggest side effect that you may see is some drowsiness or some sedation. And that might be good in this case if the person is trying to treat insomnia.
Right.
But I would want to make sure that the primary care provider who prescribed these medications is aware that there are both on this person's regimen.
Okay. I took Allegra D, but I feel a migraine coming on. Will taking 2 Excedrin migraine tablets be too much medication?
So Excedrin migraine is a common over-the-counter product that is used to treat migraines and traditionally has a couple of components in it: acetaminophen, aspirin, and caffeine. Now, the normal amount to take is 2 tablets when you have a headache. Now, Allegra D is a medication that's used to treat allergies. It contains a product called fexofenadine and also may contain pseudoephedrine. So the concern with maybe using these two together is that pseudoephedrine can sometimes cause a little bit of an increased heart rate, a little bit of excitation, and caffeine that's present in the Excedrin migraine may do the same. So it should be okay to take both together, but this person might want to realize that they may become a little bit excited, maybe have an increased heart rate as they're taking this medication. They could be safe to take together, but I'd also want to make sure that this person also does not consume a lot of caffeine, maybe as present in coffee or soda, because each Excedrin migraine tablet contains about as much caffeine as 1 cup of soda or 1 cup of coffee.
What migraine medicine can you get over the counter?
So there are a number of great migraine medications available over the counter. And one of our first-line choices when someone's just starting to experience migraines might be some of those pain relievers called NSAIDs, non-steroidal anti-inflammatory drugs. And those might be examples of ibuprofen, which goes by a brand name of Motrin or Advil, and also naproxen, which has a brand name of Aleve. Excedrin migraine is a product that contains aspirin, also another NSAID, and acetaminophen and caffeine. So you could use any of the standard alone pain relievers like ibuprofen or naproxen, or a combination product like Excedrin migraine. All of these are acceptable choices over the counter to help treat migraines.
Thank you. Can you take Maxalt 10 and Ambien together a couple of hours apart?
There is no problem with using both of these two medications together. Maxalt is a great medication that's used to help relieve migraines, and we take them at the first onset of a migraine coming on. And they sometimes make people feel a little bit drowsy or kind of sedated because, we're helping to treat that migraine and relieve some of that pain. Ambien is a medication that's used to help people get to sleep at night. So maybe, if anything, they may notice a little bit more of drowsiness, but that may not be a problem because sometimes with migraines you do want to just lay down and take a nap, and that may make you feel better. But there is no per se interaction between these two medications.
Okay. I did my weekly increase of Topamax last night, and for the first time in my life I had auditory hallucinations. Is this a side effect of the medication?
For side effects, as a pharmacist, usually I get concerned, or I think more about side effects that occur more than 10% of the time. So with Topamax, some of those side effects that occur more than 10% of the time are drowsiness, or maybe some even word-finding difficulties. Hallucinations is not one of those, but it can occur in 1% of patients. So it's a very rare side effect, but it could be possible. So for something like this, I would definitely encourage the patient to talk to their primary care provider and make them aware that they think it could be related. In that case, the provider will look more into this and see if this is truly bothersome and occurs routinely, that maybe we need to change them to a different medication for their migraine prevention.
I gave my wife one injection of Imitrex 15 minutes ago, and she threw up again. Can I give her one suppository of Phenidose 25 milligrams?
So Imitrex is a medication that's used to treat migraine, and Phenidose a medication that's used to treat nausea. And unfortunately, with some migraine sufferers, they do have nausea from the migraine itself. And in some cases, it gets severe that it causes vomiting. And that sounds, unfortunately, like it's the case for this woman. So I would first check to see if the provider who was prescribing both the Imitrex and the Phenidose was the same person, to see if they're aware that she does experience nausea when having these migraines. And if, for her, routinely they do treat the nausea, then the Phenidose is an appropriate option, and it would be okay to use in conjunction with the Imitrex. But not everyone needs to treat their nausea in conjunction with their migraine headache. Sometimes treating the migraine alone will appropriately help to treat that nausea.
Can I take Maxalt MLT with Tylenol?
Yes, that's completely okay to take both Maxalt MLT and Tylenol together.
I started taking lisinopril for my high blood pressure at night because it made me tired and weak during the day, but now I wake up with a headache. Is there a certain time I should take it?
Lisinopril can be taken either in the morning or at night, and some of those common side effects might be being tired or fatigued, so I think it was a good choice that this person moved it to a nighttime regimen. Now, it can also cause a headache, so it's possible that that is a side effect they're experiencing from the lisinopril. But it's also possible that this person's having a headache because their blood pressures are high. Sometimes when blood pressure runs high, people do notice that they have a headache. So I would encourage this individual to check their blood pressure, either at the doctor's office or by getting a home blood pressure monitor that they can use. I would just want to make sure that it's not because their blood pressure is high, and that's the reason that they're having a headache. But it's possible it could be from the lisinopril.
What can I give my 14-year-old for a headache if she's currently taking Abilify?
Abilify does not have any interactions with any over-the-counter pain relievers, so it would be acceptable to use acetaminophen, which goes by the brand name of Tylenol, or ibuprofen, which is often found in products like Motrin or Advil, or naproxen, which goes by the brand name of Aleve. So any one of those over-the-counter pain relievers would be an okay choice in someone taking Abilify.
Let's take one more interaction question. I take Midrin for headaches, but I'm currently on Adipex P. Are these safe to take together? And what about an over-the-counter allergy medication?
Okay, so the first part of the question gets to a potential problem with taking Midrin and Adipex P together. So Midrin does have some components in it that might be stimulating, might help to increase heart rate or increase blood pressure. And Adipex P can do the same. So it's very possible that in this case, taking both together might cause an increased heart rate for this individual. So I'd want them to be aware of that potential side effect and to make sure the doctor recognized that they were on both of those medications and would be adequately monitoring things like their symptoms or blood pressure. Now, in terms of allergy medications, I'm assuming they're asking for taking that with either product, either the Midrin or the Adipex P. And either kinds of allergy medications, like antihistamines that are available over the counter, would be appropriate to take. I would try, though, to avoid taking an allergy medicine that might also have a decongestant, like phenylephrine or pseudoephedrine. Both of those also can be stimulating, and again, with those other two medications that also could be stimulating, might be a lot for their heart.